Hi everyone, welcome back to my YouTube channel. Today we are going to talk about pharynx, and here at the side you can see the diagrammatic representation of pharynx showing different parts of pharynx for the reference. So let's start our topic with introduction. Pharynx is situated behind the nasal cavities, the mouth and the larynx, and it may be divided into nasal, oral and laryngeal parts. Pharynx is funnel-shaped, its upper wider end lying under the skull and its lower narrower end becoming continuous with the esophagus, opposite to the sixth cervical vertebra. Communications of pharynx. Pharynx has musculomembranous wall which is deficient anteriorly. Here it is replaced by posterior opening into the nose, the opening into the mouth and the inlet of larynx. By means of auditory tube, the mucous membrane is also continuous with that of tympanic cavity. Interior of pharynx. Pharynx is divided into three parts: the nasal pharynx, the oral pharynx, and the laryngeal pharynx. Nasal pharynx lies above the soft palate and behind the nasal cavity. In the submucosa of roof is a collection of lymphoid tissue that is called as pharyngeal tonsil. Pharyngeal isthmus is opening in the floor between the soft palate and posterior pharyngeal wall. On the lateral wall is the opening of auditory tube, the elevated ridge of which is called as tubal elevation. Pharyngeal recess is depression in the pharyngeal wall behind the tubal elevation. Then there is salpingopharyngeal fold, that is a vertical fold of mucous membrane covering the salpingopharyngeal muscle. Now let's talk about the second part of pharynx, that is oral pharynx. It lies behind the oral cavity. Its floor is formed by posterior one-third of tongue and interval between the tongue and epiglottis. In the midline is a median epiglottic fold, and on each side there is a lateral glossoepiglottic fold. Depression on each side of median glossoepiglottic fold is called as vallecula. On the lateral wall on each side are the palatoglossal and palatopharyngeal arches or folds, and the palatine tonsils are between them. Oral pharynx. Palatoglossal arch is a fold of mucous membrane covering the palatoglossus muscle. The interval between the two palatoglossal arches is called the oropharyngeal isthmus and marks the boundary between the mouth and pharynx. The palatopharyngeal arch is fold of mucous membrane covering the palatopharyngeal muscle. The recess between palatoglossal and palatopharyngeal arches is occupied by palatine tonsils. Now let's talk about third part of pharynx, that is laryngeal pharynx. This lies behind the opening into the larynx. The lateral wall is formed by thyroid cartilage and the thyrohyoid membrane. The pyriform fossa is a depression in the mucous membrane on each side of laryngeal inlet. Now let's talk about sensory innervation of pharynx. Nasal pharynx is innervated by maxillary nerve, that is branch of mandibular division of maxillary division of trigeminal nerve. Oral pharynx is innervated by glossopharyngeal nerve, and laryngeal pharynx around the entrance into the larynx is supplied by internal laryngeal branch of vagus nerve. Now let's talk about blood supply and lymph drainage of pharynx. Blood supply of the pharynx is by ascending pharyngeal artery, tonsillar branch of facial artery, and branches of maxillary and lingual artery. And lymph drainage of pharynx is directly into the deep cervical lymph nodes or indirectly through the retropharyngeal or paratracheal nodes into the deep cervical nodes. Now let's talk about muscles of pharynx. There are 7 muscles of pharynx, including 3 constrictor muscle, and 1/4 is the part of inferior constrictor muscle, and other are the different pharynx muscles. The constrictor muscle includes superior constrictor muscle, medial constrictor muscle, and inferior constrictor muscle. And cricopharyngeus is the part of inferior constrictor muscle. Now let's talk about these one by one. Superior constrictor muscle originates from medial pterygoid plate, pterygoid humulus, and pterygoid mandibular ligament and mylohyoid line of mandible. And it inserts into the pharyngeal tubercle of occipital bone and raphe in middle line posteriorly. It is supplied by pharyngeal plexus. It aids in soft palate closing of nasal pharynx. It also propels bolus downward. Second muscle of pharynx is middle constrictor muscle that starts from lower part of stylohyoid ligament and lesser and greater cornu of hyoid bone. It inserts into the pharyngeal raphe. It is supplied by pharyngeal plexus. It propels bolus downward. Next part is inferior constrictor muscle. It is lamina starts from lamina of thyroid cartilage and cricoid cartilage. It inserts into the pharyngeal raphe. It is supplied by pharyngeal plexus. It propels bolus downward. Next part is cricopharyngeus. That next muscle is cricopharyngeus. That is lowest part of the inferior constrictor muscle. It acts as a sphincter at the lower end of pharynx. Next muscle is stylopharyngeus muscle. That is styloid process of temporal bone and is inserted into the posterior border of thyroid cartilage. It is supplied by glossopharyngeal nerve. It elevates larynx during swallowing. Next muscle is salpingopharyngeal muscles. It starts from auditory tube and ends with by blending palatopharyngeus muscle. It is supplied by pharyngeal plexus and it elevates pharynx. Next muscle is palatopharyngeus muscle that starts or originates from palatine aponeurosis and insert into the posterior border of thyroid cartilage. It is supplied by pharyngeal plexus and its action is to elevate wall of pharynx and pulls palatopharyngeal arch medially. And here in the diagram you can see all of the muscles: superior constrictor muscle, middle constrictor muscle, inferior constrictor muscle. You can also see salpingopharyngeus muscle, cricopharyngeus, and pharyngeal raphe. You can also see there, and this is the diagrammatic representation of basically the muscles of pharynx for the reference. You can also use this diagram or the table to correlate with this diagram for better understanding. And this was all about pharynx. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.